Okay, okay, I'm just gonna close this off and then how do we go into this one here? I think slideshow. Oh no, maybe this one. There we go. Okay, so foam rolling and myofascial release. And then Bella, just keep me updated. If you have questions, feel free to pop them into the chat box. So we'll start off with the very basics of what foam rolling and myofascial release means and what that is all about. So what is myofascia? And myofascia comes from the words myo, which means muscle, and then fascia, which is kind of this wrapping that surrounds the muscle. And that wrapping that surrounds the muscle happens at a few different levels. So it happens at the muscle fibers, and then you bundle those together, and then you get these kind of fascicles, and then throughout you kind of build out into a muscle. And each one of those clusters of muscle fibers has its own little fascia around it. And typically, these muscle fibers and fascia follow certain planes along the body. So the skeletons here on the left kind of demonstrate a few different fascial lines. One on the front part of the body, which includes your abdomen, your muscles of your thighs. There's one on the back, which includes some of the back muscles and your hamstrings, as well as some fascia that kind of runs obliquely through kind of this X style line on the front part of your body. So what are these myofascial trigger points, or what are these trigger points? And at the most kind of basic level, they're pretty much knots within your muscle fibers. And they're basically these hyper irritable points within your muscles. When you palpate, they might even feel like a bit of a nodule. And the reason why they happen is due to kind of abnormal release of neurotransmitters in those muscles that result in kind of sustained contraction, and which leads to what's called an energy crisis. And if you kind of have sustained contraction, just the same way that you might contract your bicep, those little nodules within your muscles will result in a buildup of metabolites. And those metabolites, when they're kind of pressed on, and sometimes not even pressed on, can result in symptoms of pain. So some things that cause myofascial trigger points, or these trigger points or nodules, can be, intense muscle overload, where there's some muscle guarding, repetitive muscle stress, cumulative micro traumas, in some cases in overuse injuries, for instance, in shoulders or in the calves, psychosocial stress as well can change the contracture and the amount of these trigger points in your body, or even their sensitivity, as well as unevenly distributed intramuscular pressures, muscle guarding in the case of a trauma, and then sometimes even chronic position or postures. So what's the cost of having these of myofascial pain? And generally speaking, you're going to have pain, which gives you some level of distress, either physical or psychosocial. You might have, as a result of these little contractions within the tissue, you might have tissue length changes. So essentially tightness, which results in performance changes like muscle inhibition, longer periods of reaction time, altered muscle recruitment, and to some degree, a combination of these things can lead to muscle atrophy. And Canadians, as a result of myofascial pain, spend about, or it costs Canada about $56 to $60 billion a year in a combination of healthcare costs and loss of productivity. So it is a substantial condition with a substantial cost here in Canada. And trigger points are a cause of myofascial pain in up to 80% of cases. So it is something that is modifiable and can be treated with self-management or physiotherapy. So as far as assessment, these assessments are conducted by primary healthcare providers like your local trusty physiotherapist or massage therapist. And basically what we're trying to do in our assessment is rule out other conditions or other injuries. So things that might be like a ligament tear or sprain or strain that results in myofascial trigger points. And then part of our assessment is also identifying these trigger points with palpation. And those usually to physiotherapists or massage therapists can feel like, and to yourself as your own advocate, can be kind of taut bands, localized tenderness. And usually when you press over these taut bands or these points of tenderness, they will have a referred pain sensation, which is feels similar to the typical discomfort that you might have or you might be struggling with. So sometimes that might be like that back pain that's been nagging you, or sometimes it could be that shoulder discomfort that you've been getting. And so our job as physiotherapists with our assessment is to rule these things in and out to really come up with a clear diagnosis of what's happening. So what are the approaches of releasing trigger points? And there's a few different ones. Some are more medical, some are more self-management, and then some are more on the conservative care side of things. So number one thing you want to be focusing on is education, and what that means basically is why are these points occurring in the first place? Is it as a result of stress? Is it as a result of trauma? Or maybe it's as simple as posture. Massage therapists will usually address these in their sessions via deep tissue massage. So they spend usually that 45 minutes to an hour working a lot of those myofascial slings, like I showed you in those previous slides with the skeleton. So they'll follow and trace down those fascial lines to address trigger points along the way. In physiotherapy, you can do active soft tissue release. Physios really like to do movement, and massage therapists as well. And at that point, we use movement and trigger release at the same time, or massage at the same time. Physiotherapists also can do acupuncture and dry needling, which seems to be an effective way to reduce trigger points. In physio, we can also modulate these trigger points with pain modulation modalities like IFC or TENS, which is the electrical stimulation that we use to make your hair stand up. As well as from the medical perspective, there's medications, things like Botox, muscle relaxants, antidepressants, anticonvulsives, which have been effective in reducing more severe cases of myofascial pain. Self-management strategies that anyone can really implement are things like heat, ice. Those types of things help reduce myofascial trigger points, or at least the severity of the somatic nature of the symptoms. And then using things like therapeutic exercise via contract relax principles, which really help to essentially break up those trigger points and help reset your muscles to avoid having them. And then what we're going to be talking about today is using some of those myofascial release tools, like a roller or a Theracane or a shepherd's hook type of devices, which can be done at home. So what is myofascial release? It's a technique that focuses on relieving tissue tension using force over areas of fibrosis or adhesions or spasm. or tone that's resulting in muscle pain, length reduction, and weakness or tension. So that's pretty much kind of what we're doing either in clinic, in massage, in physio, or you're doing at home with your roller or myofascial tool, lacrosse ball sometimes. And I guess this is another really important slide here. And this is talking about, when should you start? Because everyone, I think most people are eager beavers when they first get injured. They have all this stuff that they got to deal with, what comes when, how frequently do I do it? How much, when do you even begin, or how do you even begin? And so this is just a really good slide that talks about the different phases of healing to give people an idea of, the timelines of certain conditions. So if you had an acute injury of, let's say, a muscle strain, the inflammatory phase happens within the first kind of week or so. And at this point, it's not maybe the most effective tool to do soft tissue release around or directly over top of that area. What you want to be focusing on is the tissue above and below the injured area. That way you still continue to use principles of protect, rest, ice, elevate, those kind of natural healing principles, and facilitate a good clearing of the debris that's occurred within your tissue. So no or very little soft tissue work over the injury site in the first maybe day, first 7 days following injury. Now, beyond the first 7 days, you go into a proliferative phase where new fibers and new scar tissue is being laid down. And at that point, it is okay to get a little bit closer to the site of injury. You're working through range of motion exercise and gentle progressive loading of the tissue. And you can tap into a little bit of soft tissue release over top of the injury site. And certainly, getting a little bit closer to the area. And that will promote, blood flow to the injury site and help with laying down new tissue that's scarring the injury site. As far as the remodeling phase, and this happens from about 2 weeks to about 6 months, that is probably the best time to be using devices like myofascial release tools or these myofascial strategies. And at that point, you're going to be using that roller directly over the areas that are causing you some discomfort, or directly over injury sites. And in chronic phases, which most people, I think, build up a series of these trigger points, it's as tolerated and directly over top of those knots. So if you have any kind of injury, these are probably the most important parts that you should be including. Number one is going to be some form of stretching. And this stretching and myofascial release techniques work really, really well in concurrently. So together, applied together, they have the most to offer as far as tissue lengthening, as well as pain management. You want to follow up with a motor control exercise. So basically what that means in short is firing the right muscles at the right time, at the appropriate level of contraction. And those are specific exercises that are given or prescribed by physiotherapists or massage therapists, as well as including a component of proprioception, which in short means like balance, speed, and accuracy. It's proprioception is knowing your brain, knowing where it is in space at a given moment. And then as well as including a strength exercise component in your rehab, in later rehab phases. So the 5 areas that most people can start rolling today are going to be the glutes, the hamstrings, the lats, quads, and the calves. And these areas are kind of common amongst our general population. as being contributors to symptoms of low back pain, shoulder pain, knee pain, and foot pain. So these are definitely areas, for instance, if you're having some low back pain, you know, definitely get it assessed, because there's tons of reasons why someone might be having low back pain. But these people often will have some level of trigger point or myofascial adhesions within their glutes and their hamstrings, at least as being contributing factors to the low back pain. And then as well as for shoulder pain, the big one there is going to be the lats, and usually to some degree the lats have some form of involvement with shoulder pain. Knee pain is a really common one, and the quads definitely are the most adjacent muscle that will be contributing to that type of pain. And then foot pain, myofascial release techniques and tightness within the calves, as well as the ball of or the arch of your foot as well. So maybe we'll go over this one slide, and then I'd love to share with the rest of you some of the myofascial techniques for these 5 areas. And I'll have Bryson go through some of these things with you, and he'll be my model today. And then, you know, this slide here is talking about how long and how much you should be doing these types of activities. And generally speaking, myofascial release at home, if you're doing it on your own, it should be between 1 to 3 times per day. And the idea here is that you really have to spend a bit of time applying those pressures. And usually that takes about 60 to 90 seconds per tender spot. And the level of discomfort that you might feel with that is, you know, somewhere between 2 to 4 out of 10 on a pain scale. And what you want to see, or your expectations with that, is that over the course of that 60 to 90 seconds, the discomfort at those points gets less and less and less. And usually we can regulate that release with using deep breathing techniques, such as, you know, breathing in through your nose, having a controlled exhale, to use that parasympathetic system to reduce pain sensation and let muscles relax. So at this point, I'll just take a quick second. I'm going to flip over to my camera. I can't tell if anyone can see me, but how do I pause share? No, stop sharing. Okay, and then what we'll do now at this point is I'm gonna set up a roller with Bryson, and we're gonna have Bryson go through some of these positions, and that way you guys can get an understanding of how to use these techniques at home with your own roller. So first one we're gonna start off with is gonna be for the quadriceps. And this is the one that most often you might experience, you know, some sort of knee pain or knee discomfort. Of course, there's a lot of different reasons for why someone might have knee pain. This is just one of those, you know, multiple reasons. And I think it's really important that if you do have knee pain, have it formally assessed and diagnosed. That way, you're using the right techniques, and you're actually on the right path to a success with rehabilitation. So the best way to roll out the quadriceps, the big muscles of your thigh, you're gonna basically take the roller, you're gonna put it on the ground, and I'll have kind of Bryson here. And Bryson is gonna essentially kind of hold himself over the roller with the roller slightly above his kneecaps and anywhere between the base of his pelvis. Okay, so kind of this area right here. And in this position, I'll just kind of show you, you can actually fluctuate from left to right. So hopefully everyone can kind of see that. And really commonly, you know, you're going to have a point of tenderness most often on the outside of your leg. And as soon as you find that spot, you're going to essentially hold. You're going to take a few big breaths, Bryson is already breathing. He's got a good couple spots in there. And letting basically the roller do the work. The most common reason why this is an ineffective approach for most people is because they go back and forth, and those trigger points need that 60 to 90 seconds for them to release, and it's released under pressure. It's as simple as that. So you got to find those trigger points. This is the only time I say, it's okay to, chase the pain, and then focus on breathing to allow those trigger points to relax. Okay. You're going to find 2 or 3 points and let that roller do its magic. Okay, perfect. So we're gonna flip Bryson over. We're gonna tackle his glutes. Those are the butt cheek muscles, the strong muscles that basically help you get up out of chairs, get you up out of the toilets. And then this is a really, really common one for people to struggle with, or have a lot of tender points if they have some back pain as well. So what he's doing here in this position, he's basically sat himself on the roller, and with his affected side, so in this case it'd be his left hip, he's popped his leg on his right leg to kind of stretch out the glute muscle, and then he's working his way from the base of his butt cheek all the way to the back of his hip, and then finding that position or finding that trigger point. And he's just going to breathe it out. You want to be applying pressure 4 to 6 out of 10. He's got his hands behind him for stability. I'll just kind of show you from this side too. So in this case, this is what it looks like from the back. And he's supported really well, and he's really working that left butt cheek muscle there. Okay. And if this is really, really tender or sensitive, what people will do to kind of reduce the discomfort, if it's really bugging you have to kind of lay down a few towels over top of the roller to kind of disperse the point of pressure. Okay. And look how happy he is. He's ecstatic about that one. That one's really, really helping him. So fabulous. Now, this next one is going to be for your hamstrings. Now, the hamstrings are the muscle. Do you want to just stand up really quick and show them where the hamstrings are? So hamstrings are right at the back of your thighs. They basically go from the base of your gluteal fold all the way past the knee. And these ones, oftentimes people have, like, if you've heard people say, oh, I got tight hamstrings, that's the muscle that they're talking about. So with this one's a bit kind of funky. And there's a few ways that you can do it. It's really straightforward, and I'll kind of show you, and Bryce and I kind of went over these a few times too, but I'll show you how you can do it. So basically straight legs over top of the roller. The roller is on the back part of the thighs. And then this is kind of the easy way. If you got strong arms, it's, this might not be a problem. And then there's a couple other strategies that I like to use if you don't quite feel comfortable with this one. And do you want to go into that split position, edge of the roller, leg straight? Yeah. And then see if you can pull this guy other way. Keep going. There you go. Just like that. So this is a different position which I've kind of come up with over the years of doing these things as a power lifter. Basically, he's in this kind of jackknife position, I guess, with his one leg bent back. And he's really kind of sitting with his other leg straight. That way that leg is in full extension. And he's finding the tissue. Majority of his weight in this position is going to be over top of the roller. Again, finding those tight points. Now, I know that we're not all ballerinas like Bryson, and we can't really get into these positions. So, if you're sitting at home, I'll show you what this exercise would look like. And basically, you take your roller, and I'll just kind of demo it here really quick in this chair. And the way that this is going to look is very, very similar, but the beauty of it is that you don't actually have to go all the way down to the ground. You get yourself a chair with a backrest, and then your leg is straight. And now I don't have to get myself in that deep deep jackknife position, and I just kind of find those trigger points again, right? I flex my back just a tiny little bit to get a bit of an extra stretch, and then, I hang out here. I focus on my breathing, right? 60 seconds. 60 seconds will take you about 15 to 30 breaths in through your nose, out through your mouth, right? And then you can kind of work left and right. There's different parts of your hamstring. Some are a bit more on the inside, some are a bit more on the outside. So the way that you do that is you just point your toe. I'm going to point my toe outside. I'm going to get the outside hamstring. I'll point my toe inside. I'm going to get the inside hamstring. So this is a really nice way to, especially if you can't get down all the way to the floor. Another way, now you don't need a foam roller for this, but if you have grandkids and they have a soccer ball or a basketball, and I'll just bring one over here really quick so I can show you. So you want a firm basketball. This is not a basketball, but something similar at home. And it's the same idea. You kind of hang on to the back of the chair, and this just has a bit more of a pressure. So all of a sudden, you don't need your foam roller. You can actually use equipment with like a sphere, but it just has to be pumped up. Obviously, be careful that you don't slip off the end of this. You might get yourself into a bit of trouble. But exactly the same principles. Toe out for hamstring, toe in for more medial side of things. Okay, so that's kind of an adapted way to do the hamstring, because I know not everyone's going to be able to get all the way down to the floor. Okay, so you can actually do your glutes like this as well. So you can kind of go like this, right? And that way I'm not all the way. I can support myself. It is a bit of a balancing act, but an adapted way to do your hips or the butt cheek muscles. So we did the quads, we did the hamstrings, we did the bum, and now what I'll get Bryson to do is we're going to get him to do his lats. So the lats, if I was to kind of show on Bryson here, are basically this muscle that kind of goes down the entire back, and it kind of starts from down almost at your lower back and comes up, and it makes the back part of your armpit. So the reason why you have an armpit in the first place is, or that kind of hole in your armpit, is because the front part of your armpit is made up of the pecs, the big pec muscle, and the back part of your armpit is made of your lats. So it's that muscle kind of in the back part of your armpit that we're going to be working. And the way that this one works is Bryson is going to be, he's going to pop the foam roller down on the ground. He's going to use his, in this case, his right arm. And he's going to kind of put the roller right into the groove of his armpit. Okay, and then what he's going to do here, he's going to rotate his chest about 45 degrees towards the ceiling. So exactly like that. That way he's kind of over top of the backside of his armpit. Excellent. Look at him smiling away. And then you want to kind of work from the armpit all the way down the back. Okay, so there you go. And that muscle spans kind of the back part of your rib cage. So you want to be, that's why I always ask people to kind of, their chest is about 45 degrees out towards the ceiling. And in that position again, find that trigger point. He's kind of just scanning to see where those trigger points are. The moment that he finds one, boom, he's staying in. What are you doing, Bryson?
Staying right on that trigger point.
And what are you doing with your breath?
Taking nice deep breaths.
There you go. A student well taught right there. Awesome. Good. So again, with these ones, 60 to 90 seconds. Once you kind of crank through one trigger point, go ahead and find a second and third. They're going to be scattered around through the tissue, and you want to just kind of work through them. And each time you do it, you're going to notice that there's less and less of these trigger points as they become released. Okay, and that might not happen overnight. You're not going to hit everything, all in one go, but they sure will start to. You won't find as many, and they won't be as intense the more you do this type of stuff here. Okay, beautiful. So there you go. Bryson's going to be all stretched out today. Awesome. And then the last one I think we're going to talk about, we talked about the quads, we talked about the hamstring, the glutes, and the lats. The other one that we're going to talk about today, I think, is going to be the calves. And this is one of my favorite ones because this is like your, I always say my favorite stretch is the max and relaxing stretch. And basically Bryson is going to pop the back part of his calf. This is really important for when you're walking. Okay. And if you've ever been on like the first run of the season or maybe on a long hike, basically this is the muscle, the back lower shank of your leg that gets really tired and sore. So again, in this position, he's scanning, finding a trigger point. And there's two muscles back there, your gastroc, which is the big meaty part higher up on the bottom part of your leg. And that's kind of like, I'll show you on this leg here. That's the gastroc there, okay? And then there's a deeper muscle a little bit lower down called the soleus. And this one only crosses the joint at your ankle, whereas this one actually is associated with the knee and the ankle. So there's two muscles that you gotta work through, and they will have their own trigger points. They both attach to the Achilles tendon. And so he's gonna scan, find a spot that might be a little bit tender. Hey, what if it's not tender enough? What are you gonna do? He's just gonna take his other leg, plop it on top, just like that, boom. And now he's got a little bit of extra pressure. This leg doesn't weigh all that much on its own. So like I said, you need pressure for these types of release techniques, and having your other leg might just be the thing for you, right? And again, these types of releases, like you can do them with a roller. Smaller muscles like this, the surface area of this sometimes is too big. So, you might find like a softball or a lacrosse ball that works really well instead of a roller, something spherical that has kind of that it's almost like a knuckle, right? There's a high pressure area that you can use there with a sphere. Okay. So there you go. And then what are you doing when you find those trigger points, Bryson?
Let's stay right on that trigger point. Nice deep breaths.
In through the nose, out through the mouth. There we go. Awesome. So let me just, hopefully that all made sense. I know we went through, Blair's rolling out. Blair's going to be so stretched out, he might even grow a couple inches. I don't know.
There's also a question, Radek. Like,
yeah. Here, I'm going to bring you back onto the table.
Yeah.
And before I kind of take a look at that question, okay. I'm just going to, because I only have a few more slides and I might actually answer that question. So
sure.
So I'll just share my screen with you. Okay, so share screen. We'll just pop right back into this guy. Okay, and I'll get to all the questions, I promise. So we just chatted about this 2 or 3 times per area per day. And so this will take some time. Like if you think about it, right? Let's say you have 2 or 3 on the left leg, 2 or 3 on the right leg. Each of those takes 90 seconds. You got to do it twice a day. Like it does take some time, but it's really beneficial if you do it. And this is coming from, personal experience as well as the literature. I used to do this to self-manage my body when I was, at my peak athleticism, which I'm not anymore, obviously, but yeah. So what to expect? I guess this is kind of, you invest all this time and then what should you see, right? How do you know what you're doing is actually working? So within that 60 to 90 seconds, those tender spots get a little bit less painful. And that's a really good sign that you're probably doing a pretty good job. If they're not changing, you got to ask yourself the question, am I in the right position? Am I applying the right amount of pressure? Or is this something else that I have to get checked out, right? So, and then what you want to see is sensation of kind of improved mobility or ease of movement. So let's say, you're working those lats, right? You had a hard time lifting your arm, your shoulder is a bit sore. You did a little bit of that myofascial release. Maybe you spent, 3 trigger points, that session, 90 seconds each. You lift your arm, and what you should expect is, wow, I have a bit more range of motion, and maybe it is a little bit less painful to lift my arm now, right? Or less tight, you could say. So that's something that you should be expecting even within one bout of these types of sessions. So, improved measurable functional mobility within 3 to 12 weeks of regular myofascial release and stretching. So what does that mean? That means that, over the course of that month or 2 months that you're working through this tissue, you should see some improvement with your general mobility, right? If you're working your most common areas, some of those fascial lines, then you should be seeing that you are better able at, getting in and off the toilet, for instance, reaching above your head to grab a cup for coffee, or for instance, going up and down stairs. It shouldn't be such an effort to do those basic tasks that you might already be struggling with. So that's what I mean by functional mobility. And then on those longer time scales, according to those healing timelines, we should be seeing that kind of effect. And then over the same course of those that 12 weeks, 3 to 12 weeks, we should be seeing a substantial reduction in pain from baseline. You look back, you reflect on 2 months or a month prior, and you should be like, oh yeah, I do actually feel a little bit better. Like my symptoms are reduced. Like it's not as irritable, and I could do more stuff, right, without being in such discomfort. So if you don't have a foam roller and you're not really willing to invest in spending the time to do all these techniques, there's 5 things that anyone can do to help reduce or decrease the amount of these trigger points or how tender they are. Okay, so what you want to do is, number 1, avoid being sedentary, which means time spent without movement. Okay, if you catch yourself sitting on the couch and all of a sudden that Netflix cue comes up, are you still watching? You've spent too much time on your rear end. Okay, so you got to get up and move, and you have to break up that sedentary time frequently to avoid having these kind of postural trigger points. You want to participate in a regular stretching program. So general stretching, in every direction that you can feel a bit of tension through some of the big muscles. So for your shoulders, it might be reaching your arm above your head, right? Or going up against a wall, or going through a door frame to stretch your chest out. It might be bringing your knee towards your chest to stretch your butt cheeks out, that type of stuff. You want to be following a regular, safe stretching program. You want to maintain really good hydration. So, 70% of your body is made of water, and, all of that fascial properties, the muscles are lubricated in some form of water or glycoprotein that is infused with water. You want to make sure that everything is sliding and gliding, and water is literally the lubricant that is part of that system. Okay. Another one that is important is self-care and stress reduction. So meditation, yoga, which kind of incorporates a few of these things. You want to be reducing some stress levels, or being aware of the things that might contribute to your stress. Stress utilizes the sympathetic nervous system, and when the sympathetic nervous system is going, it's that, like, when your heart rate is high, you're sweating, your pupils are dilated. Well, you also have a response in your muscle and the fascia that surrounds your muscles. Your muscles become a little bit more tense. The fascia around it becomes more tense. It becomes more responsive. And maybe tentatively, if you're getting chased by, a gorilla, that makes sense. But over, chronically, it is not a very effective strategy for your body to be in constantly. Okay, and then the final thing here is progressive strengthening. Really important to maintain a good strength program. It can be as simple as 30 minutes a day of getting out for a walk, right? And that 30 minutes at the very base level can be broken up to about 10-minute bouts. As long as you accumulate 30 minutes, it's an effective strategy. And then basically everything beyond that, as far as intensity or challenge, is up to you. But making sure, at the very least, you're getting about 30 minutes a day of light, moderate to vigorous activity. Okay, and it's really as simple as that. And then just a quick tidbit on foam rollers. it's not just a tool for your muscles. It can be used for so many different things. We use them all the time in shoulder exercises, thoracic spine exercises, hip exercises. They become a really good cue that you can use, and an effective one as well. So, maybe dust off that old foam roller, and you can be using it not only for release, but also for some of your therapeutic exercise. Okay, now I guess this is the questions and answers part. So let me just stop sharing here. All right, Belle, so let's fire away with the questions.
Yeah, there's a question from Maureen, and this was from one of your slides. What is proliferation phase?
Yeah. So basically in the proliferation phase, so you first have we'll break it down like this. So here's a muscle, you've strained your muscle, and basically there's damage that happens. And in the proliferative phase, there's different proteins and collagens and different structures that are laid down, kind of like when you get a scab. That's the proliferative phase, is that kind of a firm, hard thing that grows on your skin over top of your wound, and that's what happens in the proliferative phase. There's a bunch of deposition of nutrients, collagen and things like that are generated, and something has to happen with that, and that's when the remodeling phase occurs. Once all that stuff is laid down, you take those fibers, the scar, and you basically stretch it and pull it into what looks as close as possible to normal tissue.
Okay, and she's also asking, like, how often should a runner roll, like one leg at how many times?
I always kind of suggest, you can do this stuff daily as self-management for these myofascial. Initially, if you haven't done this stuff before, you're really going to keep yourself busy with this. But as you do it more frequently, you're going to notice, hey, I have less and less of these trigger points. And the key here is, the common mistake is, again, you have this nodule, and then you have a roller, and the roller is kind of going back and forth. And that is not a very effective, because you get a millisecond over, a millisecond over, a millisecond over. And what that point needs is constant pressure. And that pressure usually happens, or the right amount seems to be no less than 60 seconds and no more than 90 seconds is kind of the rule of thumb there. So you want to maintain constant pressure about 60 to 90 seconds, and finding 2 or 3 of those points. So hopefully that answers your question. And I like to do it, I used to, when I was powerlifting, I would do this stuff 2 to 3 times a day. Right? I know not everyone is going to be able to muster out that kind of commitment, but anything is better than nothing, in my opinion.
Is that all, Maureen?
Yes, that was awesome.
Yeah, hey, I think I saw you rolling out there. That was great.
Yeah, I was doing it with you.
Hey, right on. Good stuff. I appreciate that.
She loves the chair idea as well.
I think the chair idea was so clever.
Yeah, great. Good.
Okay, and then the next question is from Arlene. Arlene was asking how to roll out the IT band.
Yeah, great question. You hear about the IT band. Bryson and I were talking about this. The IT band is this thick fascial structure, and it is the kind of like King Kong of fascia. And it's pretty much, if you look at it, and we saw this when we were in physio school, in the cadaver labs, etc., is a thick leather belt that straddles the side of your thighs. And so it's not something that can be really rolled out, no matter how hard you try. Imagine stretching out a 2-inch thick belt. It's just not going to go. But that's okay, because that line, or that IT band, is there for a purpose. And the reason why it's there is to kind of keep your quadricep from bulging out too far. So what happens is that IT band kind of pushes from the outside of your leg to allow that kneecap to glide and slide in the direction that it needs to, and it creates essentially an appropriate force. So what people do, I always kind of recommend is instead of thinking about, yeah, you're rolling out the IT band, think about you're rolling out some of the lateral structures of your thigh, which probably have those trigger points. And yeah, so hopefully that helps. And if I was to show you what rolling out the lateral part of your thigh looks like, you can do it where, you know, you're laying face down and you're kind of on the side of your thigh, but the traditional way, I guess, kind of looks like this. So let's say I am, hopefully people can see me here. And what you do is you're on the side of your body just like this. And you're right, I'm right over top of the IT band, but just know that you're not really rolling the IT band. You're rolling the muscular parts underneath it. And then from here, you can do things like this, right? Where I'm kind of supporting myself with this leg to offload. The same thing with my arm. My arm's over here. And I'm just offloading my body. So I can apply 0 pressure, kind of like this, right? Or I can apply 50% pressure, or I can apply 100% pressure. And then I'm, again, finding some of those structures. Boom, there's a really good one that's really getting me. Hold, focus on breathing, you know, throw on. This is when you want to watch your Netflix, okay? So exactly just like this. And maybe you can even show a reverse view just so that people have an idea of what. So that's kind of IT band, and it gets, I think, for me, it's the worst around mid-thigh, usually kind of closer to the hip. There's a lot more meat there, so I don't feel it quite as bad, but mid-thigh is really a great spot to also tackle. And I would say this is kind of like on that more advanced rolling.
Mm.
Yeah.
Thank you.
Yeah.
Next question is from Susan. I had a knee replacement last summer. It's healing really well, but I have a line of pain from my hip down to my shin. Would this be appropriate to release that pain, or is that different from MFR?
So I've seen a lot of knee replacements in the clinic, and I think between Blair has been in this industry for a really, really long time as well. And you know, when they do those types of surgeries, they really pull the structures out of the way to kind of get at the surgical site. And so people, unfortunately, you know, have a tendency of suffering, you know, some pretty substantial kind of strains of the muscles around their quad. Now, the best thing that you can do, and most people, except for me, because I still have to use a wine bottle for this, but if you have a pin roller, like for making dough, you can try, because it would be really hard for you probably to get down to the floor. And I'll just see if I have a specific pin roller here. Okay, I'll just use this. But we have these kind of devices here at the clinic, and they are literally just a pin roller branded as a physiotherapy tool. And basically what you're gonna do, and I'll just kind of move back a little bit more there, and you take that pin roller and you kind of work down the thigh like this. So this is also an appropriate way to roll or find those trigger points. Again, you want to find that trigger point, stay on it, right? And there's a lot of different things that you can do with this position. If your feet are hanging, you can actually kind of go through like a gentle movement once you find that trigger point, kind of like this, and see if that will help with reducing some of the pain. And if you're the sign here is when you stand up, do your symptoms change, right? And if they do, after 30 to 60 seconds, if it feels a little bit better, if it feels a bit more loose, if you can all of a sudden kind of bend your knee a little bit better or get up the stairs just a smidge easier, you're probably on the right track with some of that kind of application of soft tissue release. But again, if this is something like you're getting like a burny sensation, or some sort of radiating pain that is not like that kind of dull ache, which is what myofascial pain usually presents like, is dull aches, then you want to be getting that a little bit, more closely investigated. So yeah, and I think rule of thumb.
Is that a fairly soft roller that you were using?
This thing here is actually a flex bar. It's for wrists, but even this, if I push hard enough, I can get a good amount of pressure through it. A pin roller is going to be just fine. Those tools that we have here for pin rolling your quads or pin rolling your shoulders are fairly firm, and it's just as much pressure as you can kind of tolerate with your hands. So those are really great for what you can tolerate as far as pressure.
Okay.
You can regulate it as much as you want to.
Thank you.
I've given those pin rollers out to a lot of patients, and they come back and like, wow, my thigh feels really good. I sit there at home, at the kitchen table, and I just kind of roll it out, and I'm looking out the window or whatever. They stand up and then go for a walk right after, or they go through their stretches, and they usually feel pretty good after too. So.
Okay, thank you.
And we have different rollers in the clinic too. So if you visit,
Yeah, some have like knobs on them, some have a little bit straight.
your free foam roller, then I can show you the different kinds.
Yeah.
Okay.
Okay. Next, from Lily. Lily is asking, when should we use textured rollers and what's the difference?
Yeah. So textured rollers versus kind of like the flat ones, all that's changing is the point of pressure. Okay, so basically a texture roller has a higher density of pressure on. Hi, Lily. Has a higher density of pressure, so compared to something that's flat, right? So it depends on how hardcore you are and how deep you really want to get with that. Using a flat foam roller will be more superficial, I would say. If you want to get really deep into the bigger muscles like your quadriceps or your glutes, a smaller or more centrated roller will be better. So for instance, if I was to kind of describe this in another way, if you had a big big basketball would distribute the force more than a softball, which would distribute the force more than lacrosse ball, for instance. So the smaller that object is, and then the best is my thumb because I can really get in there. And basically the smaller the object is, or the more little thumbs on your roller, the deeper you're gonna get with that.
Okay,
Thanks for the question.
thank you.
Okay, I think that's it. No more questions. I don't see any. Is there any other questions, guys? Before we go to our
how
site.
you want to sit.
Yes.
So do you want to be seated on the floor? Do you want to sit in a chair? Would you like to lay down? Maybe with your pajamas on and your blanket over you, ready to go to sleep right after. And in this way, just being intentional about how you're showing up for you and what is best for you in this moment. Tonight's meditation is going to be truly mindfulness and what it means to be here in this moment.
I think that sounded like Mariah. Am I right?
No, there's nothing. Anyway, so I do have, yes, we do have handouts, guys. And I will be sending you a link tomorrow in your email inboxes, and you can like download different reports for each body part. But before we go, Radek, do you have any other messages before I go to the raffle draws?
No, I think, if you have questions I am a phone call away. Just, jump on the phone or shoot me an email, or even pop by the clinic. The beauty of this is too that, hop in for a discovery session. We can chat about anything specific around your unique body and your unique condition. And I'm more than happy to help. This is gonna, I'm passionate about myofascial release because it's helped me personally get through a lot of physical discomfort. And I love sharing with anyone. And everyone's a bit different. So, the stuff that I show here is pretty generic in that sense. But hopefully it was informative that, you can see yourself, addressing some of the stuff at home. And if there's any specific questions, I'm more than happy to take them either in person or over the phone or over email. So, yeah.
Yes. So everybody can just chat in the chat box if you want any reports or any exercise sheets, and you can claim your free foam rollers with a discovery visit. Just let me know and I will actually contact you guys for that. But before we go, I have a very interesting close. I have a surprise raffle draw. I will be giving away a massage therapy session with Linda for the lucky 5. So I'll be sharing my screen.
This is what everyone really came for.
Okay, so the first winner, lucky winner is too close. Maureen.
Hey.
Thank you for coming, Maureen, and thank you for all your questions. We'll see you soon. Next. Second winner is no other than Lucille. We're done. And I think the winner is Doreen. Congratulations. One more. Nicola.
Nicholas Small.
And the last lucky one is June. So congratulations to all the winners, and I'll keep in touch.
Thank you, everybody.
Thank you everybody for coming, and we'll see you guys soon. We'll talk soon.
Nay, thanks guys.
Good night.
Take care.
Thanks for coming, Lorna. Lorna, see.
Thanks for coming out, Mrs. Wiechecki.
Oh, yeah, she probably doesn't know how to get off that thing.
I can do that.
That's okay.
Oh, there we go.